welcome. My name is Jennifer Carroll. We're going to be talking about smoking cessation in pregnant women, and we'll be discussing the dangers it has on the fetus. Pregnancy is always the time to quit. Today we'll be discussing the following topics. We'll be identifying the impacts that smoking has on the baby and if the mother smokes while pregnant, identifying impacts that smoking has on the mother while pregnant, and learning ways and resources to aid in quitting while pregnant. Let's learn about the impacts that occur when you smoke while pregnant. Cigarettes are composed of 7,000 chemicals. These several thousand chemicals, there's two that are extremely detrimental to the developing fetus: carbon monoxide and nicotine. Carbon monoxide causes fetal hypoxia, which decreases the oxygen to the placenta and the baby. Nicotine binds to the fetal acetylcholine receptors, which affect the lung and brain development in the baby. So for every cigarette that is smoked by the mom, 15% of the nicotine will pass to the baby's bloodstream. So we really need to be careful on what we're doing to our bodies while we're pregnant. In America, 19% of the low birth weight infants are attributed to maternal smoking, as well as 8% of premature births are also attributed from maternal smoking. We have here another impact is birth defects. The cleft palate can increase the rate of cleft palate in your baby, cardiac defects in your baby, and gastrointestinal defects when smoking. Here are two examples. The baby on the left has a cleft palate, and the baby in the right is holding their mother's hand through the incubator window, since they are not fully developed and they need to grow and they need to gain strength. Here are impacts that are also attributed from smoking while pregnant and secondhand smoke. Up to 34% of sudden infant death syndrome is caused by maternal smoking and secondhand smoke. Children are at higher risk of illness such as increased respiratory and ear infections, bone fractures, child obesity, and even learning disabilities when their mother smokes while they're pregnant. Here are some impacts that can occur if the mother continues to smoke while pregnant. First, the placenta abruption, which is placenta separating from the uterus. Placenta previa, which is the placenta lying very low in the uterus and covering the parts of the cervix or the whole cervix. Premature rupture of the membrane is causing premature water breaking or premature birth of baby. Ectopic pregnancy is an emergency surgical intervention that will be needed due to the fact that there's an egg implantation in the fallopian tube or outside the uterus. Here are two pictures that show what a placenta previa and placenta abruption is. Placenta previa, as we noted already, causes challenges due to the fact that there's the placenta covering the cervix. This causes challenges and complications in delivery. Placenta abruption causes lack of oxygen to developing fetus and possible complications following. Here are some other impacts that may happen to the mother, which can cause infertility, causing by the nicotine and cyanide in the cigarette as well as the carbon monoxide, causing increase of loss of eggs. Miscarriages increase the blood loss, and preterm labor causing underdeveloped baby. Mother is still at risk for all the other impacts that smoking has on health, such as addiction, cancer, lung disease. This can shorten life by 10 years. This is 10 years less that you have to live with your children and loved ones. So let's think about our choices wisely. Let's learn about some smoking cessation programs. First question is, when should I stop? Stopping at any point in pregnancy can impact the baby in a positive way. The earlier the better. Roughly 15 weeks would be the best. But never second guess when to quit. Just take the action to quit. So let's learn. How do we take these actions to quit? Quitting is a hard decision, but it isn't impossible. Especially knowing that the impacts that smoking has on your baby and you is the first to realizing how much your life will improve once you quit. There are several ways to stop smoking. As technology is developing, there's more and more. We're attached to our phones, and imagine this, being able to manage and be supported through an app and even online support groups. During COVID, it can be a very difficult time where one may be alone and need support, especially during this hard time of addiction. You can call available hotlines at any time of day to contact a counselor that can help you with this, or you can use two or three of these app services that are here listed on the slide. You can use Quit Start, Quit Guide, Practice Quit, or you can use the additional service group on Facebook called smokefree.women on contacting you to millions of different people that may have a similar situation of trying to quit smoking. Sometimes quitting can be hard, but you need to understand you have choices and options. You can go to a doctor that can prescribe the over-the-counter options, such as, or even just recommend, gum and nicotine patches. This is considered a nicotine therapy. If these options are not right for you or you have tried them and they are not working, a doctor can prescribe medication such as bupropion, antidepressant that aids the process of quitting, or varenicline, which reduces the pleasure of cravings and to the nicotine addiction. Here we have a program called The Baby and Me, which is a tobacco-free program. If you attend 4 prenatal education sessions smoke-free, then you are able to get 2 diaper vouchers at your 3rd and 4th meeting. Carbon monoxide monitor tests will be at every meeting, and they need to be negative in order for you to receive your diaper voucher, and it has to be a consecutive 3 to 4 meetings. After the birth of the baby, you can return monthly if you can prove that you're smoke-free. You can receive a monthly diaper voucher up to 12 months. This can save you almost $2,000. A smoker who lives with a pregnant woman can also enroll in the program if they feel that quitting is their priority as well, which it should be. They may also receive a diaper voucher, which means you're saving two diaper vouchers every meeting. All right, I would like to conclude with an overview. So what did we learn today? Smoking is damaging to our baby and mother, so let's quit for 2 today. Smoking can cause birth defects, premature baby, and sudden infant death syndrome. Smoking while pregnant can also cause several complications to the mother, infertility, placenta abruption, and miscarriages. And there are several resources to quit. There are texting services, the 1-800-QUIT hotline, and Baby and Me tobacco-free program. Let's go ahead and do the quiz. I'll give you a few minutes to do so. Okay, I hope you guys had time to do the quiz. We're going to review the answers. The first answer is 1. 1 is D. Second answer is to 2 is A. 3 is D. 4 is A. And 5 is D. Thank you for coming to this informative health fair. I hope today is a new chapter for you and your future, and you decide to make the decision to quit smoking for you and your baby. Thank you once again.